Now, taking these drawings and extrapolating this a little bit further, a really common thing I see are patients that have had back surgery. They may have had 2, 3, I mean, it's impressive sometimes how many surgeries somebody has. And they're not better or they're worse off. And they come to me because they just hear I'm somebody that will at least, take a look at it with an open mind, a fresh viewpoint, I suppose. And I do try to do that. Sometimes there's not much that can be done. And thank goodness for pain management in that situation. But sometimes there are things that really aren't treated or didn't go quite as well or heal quite as thoroughly as was meant to be. And one example would be a patient with this situation right here. Now, if their treating physician sees that, and they say, well, that nerve's pinched, so we'll free it up. I never drew in the back part of here. That nerve is wide open, freed up. In fact, I didn't even draw the facet joint. I made the assumption that surgeon in this situation took those facet joints clean out. They're not an offending part of this anymore. And then they had a fusion. And you might have rods and screws and whatever. And I utilized those too. I think used well and in the right situation, they can help give good results. So let's say that that operation is done. I would also suggest to you a couple of things. Number one, even if that fusion's solid, in the front, there's going to be a little motion, even micro motion, if that disc is not fixed or repaired. And remember, that seemed to be part of the problem, at least a piece of it. Number two, the height of that disc is not restored. And number three, the normal curve or lordosis is not restored. So those are just some of the things when I'm seeing a patient and they've had surgery and everything they were told went well, and gee, we don't know why you're hurting. You know, folks don't always get good results in back surgery. I don't think they're quite as hit or miss as that. And then you wind up hearing, well, gee, maybe you just like drugs, or you know, you've got an emotional problem. And by the way, who wouldn't have an emotional issue of some sort, you know, when you go through all this time, trouble, surgery, the expenses, and you feel worse off. So there's hope. And if you like, I'll take the time and I'll look real hard. I may or may not have an answer, but I'm going to look real hard and I'll walk you through it step by step and explain to you what I feel is really going on and what seems to be the most important part, and maybe what's less. And at the end, we'll try to come to a good resolution, because I'm going to do this in partnership with you. This isn't me just telling you or preaching to you what you have to do. To do well, you've got to be part of the team, and to do that, you've really got to understand what's going on with your own body and your own situation. And I'll try to do that for you.